Good evening, everyone. I will be starting. How's everyone doing tonight? Okay, thank you. All right, so good evening, everyone. Thank you for joining Zeta Phi Beta Sorority Inc. Sigma Kappa Zeta Chapter Destigmatizing Therapy event. My name is Chanel Rodriguez. I'm a member of the Sigma Kappa Zeta Chapter, and I will be going over a few house rules before we begin the event. So please keep yourself on mute throughout the event. If you have a question, please put it in the chat, or if you would like to ask a question, put your name in the chat box to be recognized. And lastly, I will be including a few mental health resources in the chat box and at the end of the event. So now I would like to introduce our moderator for tonight, my chapter soror, Dr. Roxanne Shepard Samuel. So, Dr. Roxanne Shepard Samuel is a published author, adjunct professor, CEO, field instructor, and an active member in her community, civic, and church organization. As a doctoral scholar, she is humbled by opportunity to educate future human service professionals at the School of Criminal and Social Justice at Monroe College and supervise master-level social workers from the University at Albany. Dr. Shepard Samuel is a licensed clinical social worker with more than 20 years of mental health experience working with individuals and families in New York, New Jersey, North Carolina, and Washington, D.C., where she is licensed. She is the CEO of Passion to Purpose Consultant LLC, a mental health and wellness group practice that focuses on anxiety, depression, and stress management. Dr. Shepard Samuel received her bachelor's degree in psychology and African American Studies from SUNY Brockport, her master's of social work degree from Hunter College, and most recently graduated with her doctor of social work degree from Capella University. She even studied history and culture internationally at University of Ghana, Legon. Now, without further ado, Dr. Shepard Samuel.
Hello.
Hi.
Thank you, Chanel. Thank you, Chanel, so much for that introduction. And I am excited to be here with you. This is a wonderful event that we're going to discuss tonight. Our panelists, they are phenomenal. We have an experienced set of clinicians on the video for you tonight. And one of the things that I want to just reiterate is that therapy is something that, is necessary in our lives, especially today in the pandemic. Once again, welcome to Zeta Phi Beta Sorority Incorporated, Sigma Kappa Zeta Chapter, Destigmatizing Therapy, Learning How to Heal. My name, again, is Dr. Roxanne Shepard Samuel, and I'm excited and honored to be here. At this time, I will introduce our panelists, and after their introductions, I will provide them some time to say a brief word, and then we will go into questions and answers that you may have about therapy. Tonight, our panelists are Marlene Francois Madden. She is the CEO of Hearts Empowerment Counseling Center, best-selling author of The State of Black Girls, licensed therapist, speaker, and entrepreneur. She has over 15 years of experience in the mental health field and has become a sought-after expert in the mental health, trauma, self-care, and girls' leadership. Marlene has shared her expertise at dozens of universities, colleges, community organizations, churches, and conferences, mindfully intersecting the connections between Black girls, policy, and mental health. Marlene is a pivotal force who makes it her mission to create equity in Black mental health with the astute awareness that equity and equality are not the same things. Marlene holds a bachelor's degree in psychology from Penn State University and a master's of social work from Rutgers University, Newark. She is pursuing her PhD at Montclair State University. She serves as the committee chair for the National Association of Social Workers, New Jersey chapter, for their Legislative and Social Action Committee. Welcome, Marlene Francois Madden.
Hi, thank you. Thank you so much for having me. Looking forward to, connecting with everyone here this evening and just, speaking more about mental health. So, and today's Mental Health Action Day. So I think it's a great day to be able to talk about this topic.
Thank you. Our next panelist is Ariella Florentino. She is a licensed mental health counselor, licensed substance abuse therapist, and a certified clinical trauma professional. She received her master's degree from CUNY Brooklyn College and continues her education by becoming certified in different areas of her field. Ariella has worked with the criminal justice population for the last 5 years in the public and private sectors. She enjoys working in this field because it is a population that is overlooked. She also provides consultation to new therapists coming into the field. Ariella is also a member of Zeta Phi Beta Sorority Incorporated, Sigma Nu Zeta chapter. Welcome, Ariella.
Thank you. I'm excited for today as well. Looking forward to connecting with everyone as well here. Thank you.
Thank you. Our last panelist is Kevin Cox. Kevin is a licensed mental health counselor with 5 years of experience as a psychotherapist. He received his bachelor's and master's degree from CUNY Brooklyn College. Kevin is currently working as a mental health and domestic violence consultant and has worked with families and individuals. Kevin became interested in the field of mental health when he took an abnormal psychology class. Kevin states it helped him feel confident about his choice to enter into the field. Learning about how common mental health disorders led him to want to be a part of the solution by helping others cope in a healthy way and uncover factors that have led them to behaviors that may negatively impact their functioning. Kevin plans to pursue postgraduate training and advance his career as a psychotherapist and as a future adjunct professor teaching abnormal psychology. Kevin, welcome.
Thank you. I just want to say it's an honor to be here and to have this opportunity. I think after the past year that we've all had, this is the right time to definitely have a time to speak about destigmatizing going to therapy.
Wonderful. Thank you so much. And as Kevin just mentioned, the pandemic has really shed a light on what's happening in society today, and especially for African Americans, for Black people. We have endured a lot. And within this last year, we have actually lost so many lives as a result of this pandemic. And one of the things that we wanted to shed light on is basically helping the community understand what therapy is. We want you to know everything that you may possibly want to know about therapy. And we want you to ask these questions. We want to destigmatize seeking help. We want you to open your voices. We want you to speak. We want you to talk. We want you to know that coming to therapy is a safe space for you. And you have 3 wonderful established educational therapists that are on this Zoom call today to provide you that sense of understanding and clarity so that you understand what therapy is. So I'm going to start and ask Marlene. Marlene, can you describe to us what therapy is and what does it serve? What's its purpose?
Yeah, so with therapy, the purpose of therapy is really to reduce some of that stressor that you're having. So whether it's psychological distress that you're experiencing, whether it's a situational factor, right? So for some people, it could be work stress, it could be relationships, it could be your family, it could be racial trauma that we're dealing with in the last year. We've seen a lot of that happen. So with going to therapy, it's a holistic approach where, you really get to talk about your thoughts, your feelings, your behaviors, and just figure out how do you manage those symptoms that are manifesting in a way that may not be a healthier approach for you. So you're looking at, how do I better myself in this area? So, I find that oftentimes when people do go to therapy, when they're going to therapy, it's their first time, they're not sure what to expect, or they have some myths about what therapy looks like because of what they see on TV and the assumption that, okay, I don't know if I fit the mold to go to therapy. Do I need to be on medication? Do I have to hear voices? Do I have to be at the point where I feel suicidal and that's the only way I can get help? So not realizing that, it's okay to go to therapy, even if you feel okay.
Thank you. Anyone else on the panel would like to add to what Marlene said?
To piggyback off what she said too, I do agree. It's just a space where you can learn how to do different coping skills and how to really invest in yourself in a different way. You have to be open to the process, and also understanding that we're human too, and that, we all make mistakes and it's okay too. That even in the process of therapy, you may skip or you make a mistake for yourself, but to learn how to be nice to yourself as well. I do think that that's part of therapy as well, being nice to oneself.
Thank you. So the next question that I have is, why should I go to therapy when I can speak to my friends and family, or I can just pray to God? Kevin?
Right. So I think this is a common thought that a lot of people have, especially when they're in the phase of considering going to therapy. They may think about dipping their toes into it, and then they may step back and resort to that thought. While our friends and family members, they care about us, they're not necessarily trained to do therapy. I think it's human nature really to maybe try to provide our own experience when listening to someone else. As therapists, we're trained to really try to give an unbiased ear. A friend or family member may unknowingly be biased, and that would kind of change the response or the experience that the person may have when they're speaking to them. Going to therapy gives that person an opportunity to have their own individual room or space where it's kind of just what their own thoughts, and it's not really governed by what other people might say or or feel about what they might want to speak about.
Thank you. Anyone else would like to add?
I agree with Kevin as well. It is a space where people sometimes misconstrue that when you go to your friends and family, it sometimes is biased, and sometimes we restrain ourselves, or in a sense where sometimes in my experience working with people, sometimes they try to, when they're trying to communicate, they go flustered over their words. And in that process of therapy, we tell them, well, just slow down. It's okay. But when you're talking to family or friends, sometimes your friends are like, what are you talking about, right? And they sometimes can become confused. And sometimes they become involved in whatever is going on in that experience, and they too can get lost in it, right? I don't know if Marlene and Kevin knows what I mean by that. When you're working with people, sometimes people can become frazzled and frustrated within themselves. And the role of the clinician is to then jump in and say, it's okay, just take a minute, put your feet on the ground, and let's just breathe and just sit in silence, and then let's go back to it. Your friends and your family won't be able to do that for you. They're just gonna let you spiral or just go into a space, and then you're still gonna feel the same because you haven't been grounded yet. That's what I can say for that.
Thank you. One thing that I would also like to add to that is that when you're in a space with a therapist, a trained clinician, that's a space where you can share anything. That's a safe space. You are not judged. Your information is not talked about with anyone else. And to be specific, even us sharing that information amongst other therapists, it has to be on a case-by-case and need-to-know basis. So I cannot go to Marlene or Kevin or Ariella and share what you have said to me. That's a violation. So I would have to only go to them in the event that there's a crisis or there's an issue that I would need support on. And that would be a reason for me to discuss your business. It's not something that we just talk about. So I just wanted to put that out there, that the information is confidential. One of the other questions that I have is, how often do you have to meet with a therapist? Ariella?
It depends. So some clients can be seen up to 3 times a week, at least in my case. And some clients can be seen 1 time a week. Sometimes sessions are 60 minutes, 45, or 30. It depends on what their treatment looks like. Since I work with the criminal justice, stipulations are very different across the board. But when I work with private clients as well, I usually develop that with the client to see where they are and see what also insurance covers as well, because that always plays a role too.
Okay, thank you. And Marlene, what if I don't want to talk about a certain topic with my therapist?
This happens sometimes where you don't feel vulnerable enough to talk to them, or it may be uncomfortable, especially certain topics. I find that even when you're talking about trauma, or perhaps you had a recent loss, or you just haven't had the space to really talk to someone about it before. So you feel like, okay, am I going to get judged about this? So usually I go with the client. So like if they feel like they don't want to talk about a particular topic, then we always go back and revisit what is the reason why they came to therapy. And sometimes they'll say things like, well, I struggle with expressing how I really feel. I tend to shut down. So then we go back and revisit, okay, well, what does your attachment style look like? You know, because that may be a role, that may play a role. They may be the type of person that avoid conflict, avoid, connecting with people. So having to share certain topics could be very uncomfortable for some people. And they may feel like, well, if I share this, you're going to judge me, or I can't go back and see you again as my therapist because I feel uncomfortable. I just had to unload a whole lot on you. Or, sometimes what I usually get sometimes with clients when they used to come into the office is, oh my gosh, I'm the only one who's dealing with this. I just said too much. Like, you good? Can you handle all this? Like, can you handle all this? Like, and I'm like, you're fine. Please reassure them that they are okay. So I usually use some of, there's Brene Brown has a method called braving. So I go over with them to let them know how to build trust, how to build vulnerability. And I know it does take time. Sometimes it could take a few weeks before you're building rapport, which is why it's so important for that first month or two, when you're seeing a therapist, trying to see them on a weekly basis. So that way you can build that rapport and start to feel comfortable with sharing what's happening. They may not be ready this week, but maybe in 2 weeks, they're ready to talk about what's happening. Especially because we're home to now with telehealth, they may not be able to talk about it because perhaps in the next room or 2 doors down is their significant other. And they're like, well, next week, I feel more comfortable talking about the situation.
Mm-hmm. Wonderful, thank you. So what if I don't want to talk about certain topics, but will the therapist ask me a lot of questions? Ariella.
Well, I guess it depends on the case or the person. Sometimes we may ask some questions for clarity or clarification, but never too much where it's going to make them uncomfortable, because questions can be overwhelming as well. So I usually just meet the client where they are first to see what they're comfortable with. And that's how I develop the questions in with that, at least with them. And I'm sure Kevin can echo with that as well. And Marlene, when it comes to like questions.
Thank you. Kevin, will others know that I see a therapist?
So I think you had mentioned this before. If not, maybe I was already thinking it. But again, therapy is a safe space, and what makes it so safe is that it's confidential. We're only allowed to break confidentiality under very specific circumstances. Outside of those, it's a space where whatever you say or how you're speaking is not really permitted to leave that space. So just a small example, I think there are times when some clients might curse and then they look at me like wondering if they offended me, or if they'll ask me, are they allowed to curse? And I'm saying, I don't really care, but it's nice that you care if I care. But this is your room. If you can speak the way you want to speak, you can speak in slang, you can curse, you can speak in the most proper form that you can think of. But at the end of the day, it's confidential. And we usually try to set that standard in the beginning of us working with the clients. And by doing that, we let them know what those circumstances are when we'd be able to break the confidentiality.
Thank you. Marlene, what if I don't like my therapist and I feel that they're judging me? Should I stay with that therapist?
Absolutely not. It's two parts to this. One, explore. You have to really explore, is it something, are you projecting? Does that therapist remind you of your mom, and you don't have a healthy relationship with your mom? Is it something about that therapist that reminds you of someone where you've done this with multiple therapists, where maybe you go to one session, you don't like them, you leave. You go to the next session somewhere else, you don't like them, you leave. And you're kind of like therapist shopping. So if it's that, then that's something you may want to work on. Or it could be you just don't vibe with that therapist. You're not meeting your goals. They're judgmental. And this has happened where there are some mental health professionals who have certain biases and judgments, certain privileges. And then the way they come off to their clients, it's not healthy at all. And that client does not feel comfortable in that space. And that's okay for the client to leave, because you have some clients who just continue to go back because then they feel like, well, I don't want my therapist to feel bad that I'm leaving. And that's not healthy for you, because now you're adding on additional stress just going into that space. So I always encourage them, go back to your treatment plan and your goals. If you feel like you're not meeting your goals, it's okay to leave. It's okay to let your therapist know, like, hey, I don't feel like I'm meeting my goals. I want to explore another option. I want to get a second opinion. Just like we do with medical doctors, you can do the same with therapists.
Absolutely. But how do I know the advice that the therapist is giving me is good?
Go back to your, I would say, go back to your treatment plan, right? Go back to that treatment plan and see, are you getting better? Do you feel like you're making progress? Because clients know when they're making progress. They'll say, oh yeah, this week I was having this issue and I thought back to what my therapist said, and I did exactly what you said I should do, and it worked. It worked this time. Then you know it's working. But if you find you don't have the skills, they're not giving you skills to work outside of that therapy session, then you really have to think, like, should I still be here, or do I have to go somewhere else?
Wonderful. Thank you so much. And we talked about therapy. How do you actually find the right therapist? Anybody could answer that.
I think for me, I think sometimes it depends on the scope of interest you have and the type of treatment you want, because there's different modalities of therapy. So if you want something that's more mindfulness, then you have to look for that. There are different websites you can go on to see, but you could also look up the therapist and see what their scope of practice is. And that will allow you to know what kind of therapist you're looking for. For someone that's looking for more, that's more homework oriented and more like things that are a little bit more structured, they might look for a cognitive behavioral therapist. They're looking for something that's more emotion regulation. They might look for someone that does DBT, right, with this dialectical therapy, right? Or someone that needs other forms of therapy as well can do that as well for them too.
Thank you. And if I'm not
sorry,
sure,
my internet went out.
Oh, sorry. If I'm not sure what type of therapy I'm looking for, will the therapist be able to help me? Kevin?
I think, well, once somebody connects, I think what most usually happens, you can have a phone consultation with most therapists to see if they can really meet your needs based on your presenting problem. And it's definitely welcome for someone to ask a therapist what their approaches are or what modalities they usually use. That way they can see if they are appropriate for them. Mm-hmm. That way the client doesn't feel like they're going into something that may be a waste of their time, or feel like they're going into a situation that they could have used to explore other routes.
Great, thank you. Now, Marlene, you have a specialty. So you come with an expertise working with adolescents. So I would like for you to share with our guests, what do they do for their children? Because this is a time where adolescents, young children are actually committing suicide. There has been oh my goodness, overwhelming increase in suicide in African-American young children. And can you just speak to your experience and, offer us any sort of help and direction as how we can help our own children?
Yes, absolutely. And like you said, there's been an increase, and the CDC did make that report that there's been an increase in Black adolescent youth compared to other racial and ethnic group over the last 10 years. And so one of the initiatives that they're doing is the Congressional Black Caucus and Congresswoman Bonnie Watson Coleman in New Jersey. They're working actively on this to make sure NIH is creating funding available, because they realize that it's not that like Black youth are not going to therapy. It's just that they don't have enough culturally responsive therapists that want to work with Black youth. So yes, as therapists, we kind of know each other. We know how many other Black therapists that are out there and their specialties. But then when you ask how many Black therapists are willing to serve Black teens and children, the numbers may start to dwindle down a little bit. And what I find is that when you're working with adolescents, you can't just work with them alone. You also have to work with the parents, the guardian, whoever is involved in their care. So for me, the way that looks like is that, with my practice, we do a lot of mindfulness-based stress reduction. We do a lot of DBT skills work. So a lot of that emotional regulation work that we're doing with them. And so you have the parent come in that first session. It might be one or both parents. And I do that consultation call with them in advance to know what the presenting problems are, so I can let my therapist that's going to be working with them be fully aware of it. And then when the parents involved in that first therapy session, they know what's happening. We go over like everything that's going to be taking place, and what are the stressors, the triggers, the transitions they've had, any losses. And from there, develop a plan, and you share that plan with the parents. So the parents are fully aware, here's the plan, and we're going to review this plan in 90 days to figure out if this plan is going to work for your child or not. Not only that, you still want to have the parent, one or two, whoever it is that's in charge of the child, involved in their care. So like, as you're doing those sessions every week or every 2 weeks, we're having parents involved at the beginning of the session or at the end of the session. Now it varies, because we do have a lot of like mental health professionals who send their kids to our practice. So sometimes they often like, oh, we don't want to kind of be too involved, because we want to just be the mom and a dad and not the therapist. So we'll call them on the side and follow up. But I always think it's important to have parents involved. I think right now in the last year with this pandemic, we've seen a lot of adolescents who's been going through a lot of distress with being online, distance schooling, things around microaggression that they experience depending on the schools that they go to. A lot of kids are going to competitive schools, or they feel like they have to do well in sports. So there's a lot of demands that they have, and they just are having a hard time connecting with their parents or connecting with teachers in schools. That's another topic for discussion, just the adultification biases and the racial and gender discrimination that our brown and Black children are experiencing, even in our own communities, because we don't have a lot of Black teachers in the school system. So you have to ask yourself, how are the white teachers and white administrators treating our children, and how is that impacting their psychological well-being? And are parents able to see that? So it's a whole lot, and I don't want to go too far off topic.
Thank you, Marlene. And one of the other questions, since you brought up the virtual world, can therapy still be effective for children in the virtual world?
Absolutely. We have teens who come on virtually and they love it. They show up. And what's interesting is that sometimes you don't show up virtually for school, but then for therapy, you're okay with putting your cameras on. So really meeting them where they're at. If you find that you're struggling with them, giving them activities to do. So perhaps you're having them color and paint while you're in that session, and you find that they're talking a little bit more. So it can definitely be effective. And if you find that it's not effective, maybe the child needs another therapist, or perhaps finding a therapist who has some in-person visits, because I know now a lot of therapists are slowly, thinking about going back in person. So finding a therapist that's in the office, because perhaps being in an office, you can be more hands-on with some of the worksheets, or maybe like play therapists. They have all these cool toys in their office where they practice play therapy.
Wonderful, thank you very much. Kevin, can you share with us what are some of the positive effects that someone can actually get from therapy? We had mentioned before that someone receiving therapy will go back to a friend and say, you know what, this worked for me last week, and I'm so excited, and so on and so forth. Can you share some other positive effects that therapy can provide for our guests?
Sure. I think as therapists, we're always glad if we're starting to notice that our clients have a higher level of independence. So like they feel like they can rely on their opinion or their thoughts. They don't feel like they have to depend on asking a friend or even us as therapists. They've gotten to a point where they trust themselves. Maybe they'll come to us and tell us what they may be thinking rather than coming to us and saying, this happened, what do I do? Along those lines, I think other positive effects is they feel more comfortable with themselves. They feel a lower level of distress if something does go wrong, because as things will always go wrong. Maybe they don't feel like they're panicking as much, or their anxiety level doesn't skyrocket the way it used to be. There may be a change in how a change in how they may have responded to things that happened in the past compared to now.
Great, thank you. One of the other questions that we have is, what if I can't afford therapy? Like, how much does therapy cost? Go ahead.
I think therapy, it depends on if it's a private practice, because usually clinicians, it can range from different variables. But if you have insurance, sometimes you have to see if the clinician is under your insurance panel, if it covers it, because then you would only just have a copay. There are certain services that do allow a fee for service. There are some institutes that allow fee for service as well. And that sometimes is based on income, or it's just based on, like, I know since the pandemic, they've had some service, I know in Harlem and some parts of Queens, where they have the minimum is like $35 per session because of the pandemic. And like the large amount of people that are open more essentially to therapy that are coming in now. So they are having different programs and piloting different programs. And they have, I know the newest one right now is NYC Well. And I think that one, they offer sometimes free services too for low income as well, but it depends on the insurance and what the scope of practice it is too.
Marlene, can you add to that?
Yeah, I was going to say, I always advise people try to go through your insurance to see if they can give you, because your insurance company can send you a list of therapists within your area that takes your insurance. And now, because everything is via telehealth, if you are based in the state of New York, you just have to see someone who's licensed throughout the New York area. So they may be a 4-hour drive away, but now because of telehealth, you can see them via, Zoom or the telehealth platform that they utilize. So you can go through that way to find a therapist, or also to, if you have to pay out of pocket, most therapists do this where, the fee, like Ariella said, the fee ranges depending where you're located. The fee, around where I'm located at in New Jersey, the fee range is usually around $150 per session. And it can go up. And if it's couples therapy, it could be in the 200 ranges or 300 ranges in Manhattan. So I always advise people, check with your insurance company to see if you have out-of-network reimbursement benefits. Sometimes with out-of-network reimbursement benefits, your insurance may reimburse up to 80%, maybe even 90%. So if you find out your insurance company says, we'll reimburse you 80% if you pay $150, it may be beneficial to pay the $150, you get the reimbursement from your insurance company, give you a check in the mail. And so now you can look at it as like, okay, well, my insurance company gave me $140 or $130. So now I'm paying that difference in therapy. And some therapists, they will only charge you that difference and they will get the reimbursement check from the insurance company, while other therapists will say, no, you have to manage it with your insurance company directly. And there's also some other sources out there like the Loveland Foundation. They've partnered with Therapy for Black Girls. So you get 4 vouchers, which are up to $120 a piece. And so you can go and see a therapist and give them that voucher. So if the therapist charges, let's say that therapist charges $130 per session, but you have a voucher for $120, now you're just paying the $10 difference. And some therapists are also on a platform called openpathcollective.org, I want to say, where they have a few sliding scale slots where they may charge $30 or $40. So you can always check with the therapist if they have a sliding scale and what does that look like for you.
Wonderful. Thank you. Thank you for those resources. Now, the big question is, why is therapy so much? And everyone can answer this question. Why does it cost so much to see a therapist? Why y'all charge so much money?
Well,
See, when we start talking about money, everybody get quiet, right?
I have no problem talking about money. So my practice, we're a group practice. We have 4 Black women therapists at our practice. So they're the ones that are mainly seeing the clients now. And we only take one insurance, and the rest of our clients are okay with paying out of pocket. They pay the full free rate. We haven't had an issue with it. And so this discussion comes up a lot. Why does therapy cost so much money? Now, if all therapists were to take all insurance panels, the insurance panels, insurance does not pay us the rate that we should be paid at compared to people paying out of pocket. They don't. Where if I were to go see my doctor, my physician for a physical, me seeing him for 10 minutes, because we know they don't take that long. They look at the paperwork that you already filled out. They're not going over that paper and say, hey, have you ever had asthma? Have you ever had this? You're pre-filling that out before you walk into their office. And they just look at all that, do a few things. Not all doctors do this, but I found this with some doctors where you go in, you spend 15 minutes there, you're out. And if you look at that bill may be $300, but your insurance covered most of it. So you're just paying the copay of $15. But your doctor was able to see multiple clients within that hour and made what they made. As therapists, we're only allowed to see that one client within that 45 minutes to an hour time slot. So we have to think about how many clients can we realistically see to support ourselves, but also keep a business running, because there's overhead costs. So, to rent an office space in New Jersey or New York City is not cheap. It's expensive. You're paying another rent or mortgage. Not just that, you have to think about your marketing. You have to think about your accounting systems. If you have staff, you're paying payroll. You have so many expenses that are associated with it that it's really difficult to just take insurance. And insurance companies, they do not pay us all the same rate. So I may get paid a particular rate. I'm just going to use simple numbers because the insurance company doesn't want us to talk about our figures with anyone, including therapists. Let's say an insurance company pays me $6, but yet my colleague who's in Chicago, that same insurance company is paying her $12. So the insurance company does not pay us all the same rate. And when you ask for an increase, they may say you have to wait 2 years to get an increase. And that increase could be $6. Because that was my experience. That increase to me was an extra like $30 for one particular charge, but then a decrease in another charge. And they're like, well, that's the going rate in your area now. So they make it very difficult to really serve everyone the way you want to. And you can't see so many clients. If you try to see 20 clients in a day, that's virtually impossible when sessions are 45 minutes to an hour. So you also have to think about your own well-being in the midst of also seeing clients. And liability, yes, liability insurance. So I pay liability insurance. I pay professional liability insurance. I also pay for there's another employment insurance that I'm paying for. So there's a lot of cost that's associated with even the business side of running a therapy practice. And let's not again get into it with being a brown and Black clinician, where we know our student loan debt is higher. When we look at equity with income disparities, white clinicians have more opportunities than Black and brown clinicians. They are able to go and take a psychoanalysis course after they graduate, where for some of the Black and brown clinicians, we may not have that opportunity right away. So there are so many disparities that we have to think about that I really wish insurance companies would just pay clinicians a fair wage so we can really serve everyone.
Absolutely. Thank you so much, Marlene. That was excellent. And to add to that, does anyone else want to add before okay. To add to that, we also are required to maintain 36 hours of continuing education units. And that cost, for the most part, those courses are not free. And they range based on what you're required. And some states have certain requirements. So you're not able to just pick and choose and say, okay, well, I want the $50 courses. Sometimes you have to stick with whatever that state requirement is. And you have to have those 36 hours for each state. Sometimes you can overlap them. But again, what Marlene has shared is that to be a Black and Brown clinician servicing our community, it's really expensive on us. And we don't want to pass it on to you. And we've been trying to go through legislations, NASW. We've been like, I've even called out to the council people to just, shed an ear and tell them, listen, we need fair wages, and like Marlene says, a lot of us are not being paid what some of the other white clinicians are being paid. So that's why therapy actually costs what it is. And that's why a lot of Black and Brown therapists do not take multiple insurance plans. So one of the other things that I really want to get into, because we're almost approaching time, is what type of symptoms, can I have or should I look for to determine if I need to see a therapist? Like, where do I draw the line? How do I know that I need to see somebody? Anyone can answer.
I think if it affects I think anyone should go to therapy, regardless if you think you have symptoms or not, because you can always get something out of it, even if it's a space. But if you're having difficulty, sometimes we do say to people, or I say to clients, if you find that you're having difficulty in your social, occupational, and interpersonal relationships consistently, there may be something that you can work on, and to be open to working on it in treatment, So that's one way of knowing whether or not you need support, extra support in an area of interest. Mm-hmm.
So is there a type of person that should go to therapy? Do I have to be crazy?
No, well, that we don't use that, but no, I wouldn't say that, but anyone can go. You don't have to be for me, I don't think you have to be in any spectrum of it. You could just be someone you could just be a situational thing. You could just have lost your job. You could have just lost a family member. You could have just lost a friend. You could have, lost a person to incarceration. Things of like all those things could be an everyday situation that can happen. Even if you witness something that happens on the train. New York City is very traumatic. I think sometimes we minimize how traumatizing it is to live here. It's very traumatic to be here. So any one of us can just go, and we would be surprised of how much would actually come out of us when we realize the kind of pressures and how much we live in. Even your work environment can be a space where you need to go to therapy for it, and that's okay too, because we also know there are some work environments that can be very abusive to us as well.
Yes, thank you. Marlene, you wanted to add something?
Yeah, I just wanted to piggyback off of what Ariella was saying about work being very traumatizing or triggering for a lot of people. I find that especially, so like in our practice, we have a lot of Black professional women that come into the practice. They have these corporate jobs, they're attorneys, they sit in the C-suite, and their job, it's so demanding, but it's so demanding for the Black women, but not their white colleagues. They have to work 10 times harder. And when they do get that promotion for upward mobility, they find that I'm getting this promotion with a new title, but the salary's not coming with it, or new job roles that really help me to move on to the next part, or just going into rooms and people talking over them. So a lot of the micro, macro aggression that they experience. So then that will sometimes lead them to come to therapy. And what I've done before for a few clients is that if I find that this stress is really overwhelming and you need to take a leave from your job for 3 months, 6 months, I will write that letter for you. Mm-hmm. And you can give it to your HR department, and I will communicate with them and send updates constantly. And now you get to be home, work on what you're dealing with, and you find that their health will start to improve. Their blood pressure starts to lower. Their medical doctor now is like, I can take them off of all these antidepressant or other medications that they had because they're on medication as a result of racism. Mm-hmm. And so I find that that's why it's so helpful to try to go to a clinician who looks like you, because they can understand that, where perhaps maybe not all, but some that are not, that are not people of color may not understand, what you're dealing with. And, I got to make sure I don't get myself in trouble, but you guys get the point. Health equity, right?
Right. So we have a few questions in the chat.
Yeah.
So one of the questions is, do therapists go to therapy?
Yeah, they do recommend that we get some. We do need somewhere to lean on, and that's the truth, because that's a lot sometimes. So it is. We do. We at least get consultation, or we do. I know, at least for me, I know I do.
How do we demystify the stigma of going to therapy for the elderly? Because now we have the older population. How do we help them get therapy?
I think probably the easiest way to even start that approach is just speaking about it, doing things like this panel in this modality, and even in more casual conversations is helpful. The same way that we are able to bring attention to things like cancer and diabetes. I think that's all part of destigmatizing it. Us having this in this realm is great. And if we were, for example, if I were able to go to a barbershop and have a conversation about therapy with a group of Black men, the same way we would have a conversation about the playoffs, I think it would be phenomenal. There may be someone who goes home and instead of yelling at their kids, they go to their therapist and tell them how much they want to yell at their kids and explore why. I think it's hard, but I don't think it's impossible for us to just change the narrative around that, but it just takes more effort. And it might take our generation and the next generation to kind of band together and just kind of confront the older generation about some of the things that some of the ways they've been stuck in their roots, and how nothing's going to change if they just continue to do the same things or believe the same things. I think over time, what we're noticing is that slowly but surely, more people are opening up to the idea of therapy. I also saw somebody in the chat, I'm just going to tie it to their question about the pandemic. I think this past year, a lot of people have opened their eyes to how much their mental health can be impacted, and how important preserving their mental health is. I think one of my clients, he came in saying that he was really stressed out for over the past year. And I asked him if he thought it was due to the pandemic. He told me no. And within 2 months, he came to the realization that a big part of what he was experiencing was due to the pandemic. It kind of exacerbated everything that he had already been going through. And I think just to go back to the original question about the older generation, for example, we know that, they may have made certain sacrifices for our generation, such as just kind of working 2 full-time jobs and not realizing that kind of takes a toll on them mentally as well as physically. So having conversations as simple as that, might not make things change immediately, but it's a way to just get the ball rolling.
Okay, thank you. The next question in the chat says, how do we demystify the stigma of people who feel that they could just pray things away?
So my background, I'm a Christian. I grew up in a church. I actually grew up in a strict Pentecostal church, Haitian church. So, generally my community, the Haitian community, is always, you pray about it. You go to your pastor if you have an issue when it comes to what's happening with your emotions. So one of the ways I feel like we really have to partner more with spiritual leaders, community leaders, and activists. So what I've done, so like Kevin, you mentioned a barbershop. I went into it last year and the year before for around Haitian, not last year, 2019-18, before pandemic, for Haitian Heritage Month, which is May, and it's Mental Health Awareness Month. We went into a barbershop where majority Haitians go into, because there's a Haitian bakery across the street, a Haitian restaurant across the street. We went in there and we spoke in Creole and English, and seeing family members say like, wow, I thought my son who came home from the military was just being lazy. Why can't he get a girl? He needs to get married. He's filthy. He's this, he's that, using all these words. And we're like, well, perhaps it's PTSD. And then when we address the symptoms, they're like, you know what? I get it now. I need to go to therapy. I need to help them. So I think we have to go into their environment. So doing talks like this, going into churches, and I've done that within my church and other churches where I'm going into churches and we're having casual talks about mental health for them to realize that their ideology of mental health is not what it really is right now, that anyone and everyone goes sees a therapist. People that they admired, they did not realize that, oh yeah, people you think that don't need therapy, they're going just to have that outlet. So I think the more we can go into the community, it's really going to change the game for people, and letting them know where they can go for therapy and that it's confidential. I think that's people's biggest fear, is that if I go and talk to you about it, you're going to go and tell so-and-so about it. And it's like, no, we hold, it's confidential. My church, we have a counseling department where people have a directory they can call whichever therapist. There's support groups. So sometimes if people aren't comfortable going to therapy, perhaps going to a support group may be a better way to just have a group that you can talk to, and then you can slowly work your way to seeing a therapist.
That's great, Marlene. And you touched on something which is very important, is that a support group is something that I think most clinicians encourage. It's a safe space for the most part where you can have, you can be in community. One thing about the support group is that the information is as good as it is with the people who are in that group. So it's a little bit different in terms of having that direct contact with your individual therapist, but it is a way to be in community. So we do encourage support groups. Another question that was in the chat is, under what circumstances can a therapist break confidentiality?
So I'll answer it since I brought it up earlier. So definitely if there are any suspicions or mentions of suicidal thoughts, homicidal thoughts, child abuse, and elder abuse, you guys can fill me in. I don't think I missed anything.
No, that was it. I mean, if there's a plan and intent to kill yourself, then yeah, we do have to call that in to protect you, and to protect everyone else as well inside of that. I know for me, it is homicidal thoughts, well, plan and intent that I have to always report for myself, for the clientele that I work with at least, and suicidal as well, which is also very big in the criminal justice system. A lot of people kill themselves there too. So that's something also that people don't really aware of. Sometimes the people that are screaming in the street is a lot of trauma that's going on, and they're just trying to clear their head. Tell people sometimes be aware of it, especially with the pandemic. A lot of people, besides there's two sides of it. If it's okay if I could go into it a little bit, a lot of people just came home recently. So, and I mean a lot. And a lot of them were inside during the time of the pandemic. And then when they came out, they thought the amount of people that were on the outside, what was left. So now that there's an increase of people actually coming out, you're going to see a lot more people a little bit more hostile because they're not used to the numbers, right? If you're incarcerated for a very long time, you're not connected to a lot of people. So we're maybe used to a certain amount of people. And I'm sure we could all agree, everyone even in here, that those of us that worked in and out of the pandemic, that now that people are starting to come out more, we're a little bit more like, oh, I don't know how I feel about this, to keep that in mind, because that is a stressor, to keep that in mind and to be ready to talk about it too with friends and family, or to someone to consult with as well, because that is a new stressor that we're going to experience now that everything's opening back up. We may be excited about it, but it's something that we should be all concerned about as well as people. I saw one of the questions we're asking them, how do you get children? We actually talked about it earlier. If you can find support groups, because sometimes there are support groups for teenagers and for adolescents as well. I just wanted to add that because it went all the way up. There's a lot of questions in there. So I just wanted to be able to answer that you can find support groups for children and for teenagers so they can be inside of a group. Sometimes a lot of adolescents are not open to working with therapists because it's an adult. So for them, sometimes they identify as adult, as an authority figure rather than someone that can be supportive to them. So sometimes having them in a group dynamic can help them.
Okay, thank you. The next question is, how do you not show judgment in your face and demeanor when clients are sharing their experiences? Marlene?
Yeah, so you definitely have to practice that, work on it. I think if you have supervision, so as therapists, once you graduate from your master's program, you are spending the next 2 to 4 years having some sort of clinical supervision with a clinical supervisor. So I think it's important to talk about that with them, to know like, okay, how do I make sure I don't say things the wrong way? Or how do I make sure I'm not shocked when they say something? It does take experience. I always tell my clients nothing shocks me anymore. And I think it's because when you work in various settings, you start to be okay with it. You're not desensitized because you can still have empathy, but you start to understand. So, I've worked in like adults and children inpatient psychiatric hospitals, worked with sex offenders, worked with those that are in a forensic hospital setting, to children in foster care. So when you work in some of the more high risk environment, as they call them, then you start to become more aware of what's happening out here. And you're like, you don't become shocked. You know that sometimes people are reacting to their environment, to things that has happened to them. So you just got to work through it. Work through it with supervision. And if you find that it's happening often, then as a clinician, you have to take a step back to see if you have any judgment or biases towards your clients, because then you may have to take a step back and work with someone, go see a therapist too, one-on-one for therapy, because that shouldn't be happening. Your client should feel comfortable just saying anything.
Wonderful, thank you. The other question is there a right way to ask your insurance company that you would like to see a woman of color woman of color as your choice?
I think they should just ask, and they shouldn't be ashamed about their preference. Because if a white woman wanted to ask for it, a white woman specifically, they wouldn't be ashamed to ask. Everybody's entitled to their preference.
Yeah, I agree with them. You don't have to be ashamed of it. I mean, there's a lot of, they just put some in the chat, some places that you can look for specific people of color or just Black people in general. As inside, they have registries now for us to be found in places, but you could just ask your insurance company. I tell people, don't worry about asking those questions, because if people want to advocate for themselves, they will, and they do. So clients are very vocal when what they want and what they don't want. So just finding your voice is probably just step 1, 2 in that area.
Okay, thank you. And I'm going to go back to a question. I believe we may have answered it, but I don't want to overlook it. It says, what techniques can parents use to get their resistant child to see a therapist? Marlene?
Yeah, so we've had clients where the first session, they're very resistant. They don't want to go to therapy because sometimes it's not that they don't want to go, but they feel like, I failed my parents. That's why they're sending me to go see a therapist, because I'm the one who did something wrong and I have to go see them. So sometimes that first session they come in and they're just like arms crossed, don't want to talk. They're like, I don't know why I'm here. Or sometimes they'll cry. But then you'll find by the second, third, and fourth session, you can't get them out the room. You can't get them to stay quiet. They miss a week and they're like, Miss, whew, I got so much to tell you. Where were you at last week? They start to, talk a little bit more when they realize, wow, this person is for me and not my parents, but for me, and advocate for me, and will, this is a confidential space. I can tell her anything. That's not going to be, if it's an imminent risk or danger, they know we will share. But they start to share. But back to Ariella's point, sometimes sending them to like a teen group. So having them, a lot of therapists, we've offered groups before where you have groups that may be on just like social skills, or a processing group, or like a group on empowerment. And now they're in a group with other teens that are around their age, and they may feel a little bit more comfortable in that environment. And once they're in there, then they'll find out, oh, you got a therapist too? Oh, you do? Mom, I want a therapist too. So I find that with teens, when they find out their friends have therapists, they're like, oh, I want a therapist too, because it becomes a cool thing to say, oh, well, I have a therapist. Like, it's like it's the new thing. They all want a therapist. And I would say, if you're having a hard time, have your child sit through the directory with you. Go on therapyforblackgirls.com, therapyforblackmen.org, melanin and mental health, cliniciansofcolor.org. You go on these websites with them, you put in therapists in your area and you have them look through the directory, because your child, when you see their whoever's face that therapist is, you have to connect with them. You have to read the bio and feel some sort of connection before you make that call. So your child can tell. Your child can say, yeah, I'm feeling his vibe. I like her vibe. Yeah, I think I want to go to them. So for me, my practice, we serve teens and young women. So I had to make sure when I did my photos, I was in ripped jeans and a t-shirt, because that's how I dress at therapy. Because when teens come in, they don't want to see me in a suit. I don't work in corporate. So I show up in ripped jeans and they're like, okay, I like you. You got on ripped jeans. Cool. And they can show up in their pajamas to therapy. And I'm okay with that. You want some tea? I got some tea in the office. You want pink Starburst? I'm going to make sure I have pink Starburst for you next week. So like really setting the tone for them, and for them to feel like this is really a safe and affirming space, especially when we're talking about Black kids. We need to have safe and affirming spaces for them, because they do not have that in schools. They don't really have it in a lot of spaces. So therapy is a great place for them to have that. So start off with the group, but also to let them go through the directory with you so they can have some autonomy and they feel like they're a part of the process.
Thank you. And just to add to that, one of the questions in the chat says, wouldn't it also be helpful that education about therapy starts earlier in person? Educational career, such as high school, mental health is often overlooked. So shouldn't we start much earlier and talk about therapy in high school? Anyone can answer that.
I definitely agree with that. I think as I was going through undergrad, I realized that not everybody took Psych 1, which is the introductory class. And I really felt like it should be one of the core classes that everyone should take in order to graduate. And I think that definitely can be applied to the high school level. I think someone mentioned earlier that more and more, a lot more adolescents are harming themselves or are experiencing different stressors. So if they just had that introductory knowledge, that would help to destigmatize the topic a lot more. They'd be more willing to ask for help. You know, they might feel less ostracized for what they might be experiencing.
I agree with Kevin. I think what happens is that in the educational system, they wait until the student is either acting out or like some bad behavior, like they like to call it, happens, and then they want to help in some form of fashion. But it's not, sometimes it's more punitive than it is help, sometimes in some regards with some cases. And it's just by the time they reach them, it's already bypassed certain behaviors. And I think it is important for them to start early. I think also like reminding parents too, that they are also part of treatment too. That they should too, not just the child, but just everyone should be going together as a group too. Because if only one person is getting treatment and there's more things going on at home, it'll probably remain the same. You know, because if the person is like, especially if it's a child, if they're living in that environment, it doesn't matter how much treatment they get, unless the rest of the family is also getting treatment, it'll remain the same in some regards.
Okay, thank you. One of the other questions, and then we'll move on to pretty much almost closing the segment. But do you think there's a risk in taking a leave of absence from your work for mental illness? In the example given that a letter was written for a client to take time off, is there a risk of being fired by your job? Now, just also before, Marlene, before you answer that, I just want you guys to know on the Zoom that information here does not constitute therapy or advice or any sort of legal advice. Okay, go ahead, Marlene.
So in my case, no, it hasn't. And these were people who worked in like high corporate jobs to working for, you know, federal government jobs. And every job has their own protocol and process as far as how it's done. But most of the time you're dealing with the, like whoever the short-term disability department is or the HR department. So you're not dealing directly with their boss. I'm not getting phone calls from their boss. It's just, you're working with the agency that you have to send a letter to. And you keep things as simple as possible to get them the time off from work. And the job is not asking them any questions. So their colleagues can say, oh, you're taking off work? Like, yeah, I'm taking off work taking off work because I want to. You don't, it's not, they can't do anything about it. And if you do find that you are fired from it, then that becomes another issue with legal actions that you can take with the job. So I don't think jobs are going to do that. But I haven't had an issue. What I found is that it was more progression. So if you can't go to your therapist, you can also go to your primary care doctor. My best friend is a physician, and she's done the same thing for her clients, her patients that come in where their symptoms were a result of their job. And the minute they took the time off from work, she saw that they were getting better health-wise before they returned, and then set them up with a therapist to work on managing your symptoms and, better boundaries. And then you go back to work and you start to feel better.
Okay, great. Thank you. And the last question from the chat is, can you have God? And I believe we answered this before, but can we have God and a therapist? Go ahead, Marlene.
I mean, God made therapists. I always tell people, this is my running joke. My running joke is that Jesus was a social worker. For those who are faith-based, right? I always say Jesus was a social worker because he was out here in the field doing mission work. And that's what we tend to do. But you can definitely have both. The same way you can have God, or if you have another higher power that you serve, and therapy and medicine. You go to your dentist. If you have to call 911 to get in the ambulance because you're having an asthma attack, you're not going to sit at home and pray because you have an asthma attack. You want someone to send you to the ER so you can get some oxygen. So it's the same concept. You can have both, and you can also have a faith-based therapist. There are therapists that are actually Christian therapists that practice from a faith-based perspective. So you can also have access to that too.
Wonderful, thank you. And one topic that we really did not touch on, but I just want to bring it to the forefront, is substance abuse. From what I've read, the increase in wine usage has skyrocketed since this pandemic. And what the research is saying is that a lot more women is drinking. So the question would be, do you feel, and when do you know you should get help for your drinking, especially when you've started drinking during the pandemic and it's something that you don't normally do? Is it a problem? Should I seek help?
So you're actually right. It's not wine, it's just alcohol in general. There's been a large increase in DWIs. I do DWI assessments as well. Because alcohol or liquor stores were considered an essential business, the moment from that on, when I say the amount of DWIs that came in since then, it's overwhelming. That's what I'll say. It's the first time in a long time that we've seen a large amount of people coming in like that. But it's a lot of people from corporate America, a lot of people that have careers that actually don't want to acknowledge either that they may have a drinking problem at this point because of the pandemic. And I think that's some of noticing that it is an increase statistically. It has shown a lot of that in the criminal justice system in general, the spike of it. And just understanding, if you are starting to do it every single day, every time you come home, you probably have to check in with yourself. You have to find another means of coping with dealing with your job that thinks you are on call 24/7 now because they can have you at home too. I've been suggesting to a lot of people that have been coming in with DWI assessments was that to really start to set boundaries with their job and understand that just because your boss sent you an email at 1 a.m. does not mean you need to reply. And it also doesn't mean just because it's 5:30 and they said, I know you're around your phone, doesn't mean you need to reply. Because I know in some cases, some people during the pandemic, their jobs did not give them a separate phone. They had to use their personal phone to do it. And that has become a really big barrier to being able to separate work from home, but trying to get that there, and then also identifying how often and how much they're drinking in general. But it's everyone across the board. It's a lot of people drinking right now, and it is a spike. It's a little bit concerning about how many, but I do encourage everyone to please really check in with yourself and see how much. If you're doing it every day, you should probably check in with yourself.
Okay. And lastly, men and therapy. What's going on with the men? Are men coming to therapy more? Do you see that in your practice, at your jobs, in your location? How, and if they're not, how can we get men to come to therapy? And is there a need? Kevin, you want to answer?
Sure. I think there's absolutely a need. I think it's interesting. Society kind of puts men in a interesting category where a lot of men maybe feel like they're not supposed to show any emotions except for anger, or that anger is the most accepted form of emotion that they can show, which obviously is not healthy for them or people around them. I think I'm starting to notice that maybe it might not necessarily be anger that they come to speak about. It might be things about their job or relationship issues that they may come in to speak about. But it might all be there, and there may be a running theme. And as long as they get that foot in the door and come into therapy, and they're willing to be open, then there's a chance for them to really open up and be vulnerable and start their healing process. What I had said earlier about the barbershop actually is a really good idea. It's a place where a lot of men congregate, whether they're getting their haircut or not. It's a place to probably catch men where they're not feeling on guard. And a lot of men going to the barbershop might feel kind of therapeutic. You're getting groomed. You have a relationship with your barber. You may be speaking to him about what might be going on in your life, with your job, with your spouse, about somebody who you have drama with. So I definitely think it's there is a need for men to go to therapy right now. A lot of times, as men, our egos may prevent us from acknowledging areas where we can improve. We might look at therapy as something for people who are weak. We might look at it as we don't need that, or we'd be better off if or we'd only go to therapy if we hit rock bottom. Prevention is definitely better than just kind of rebuilding from scratch. And I think the faster we're able to just kind of portray that to men in different areas, the easier it will be for them to start coming out a little bit more.
Thank you. So at this time, I will have our panelists give their last words, share any information that they feel our guests can definitely benefit from. So we will start with Ariella.
Just some last thoughts. For me, I just want everyone here to really find their voice and find their place of comfort, whether within yourself, and really hone in on what you want and really speak up for yourself when it comes to finding the therapist and getting the right treatment. Listen, finding a therapist is like dating. And I say that it's really not, it's like dating. If you're not comfortable, you don't need to stay. But after a while, if you keep doing it, you probably have to check in with yourself at that point. But really find your voice and really find a way to identify what your needs are, because that's the only way we can really support you, to really help you and guide you through that process. So that's a little tidbit I can give back, to really give yourself that gift of that space.
Thank you. Kevin?
I guess just along the lines of what the theme of this panel is about. Going to therapy, especially when you start, it's not the easiest process in the world. And I don't think it's meant to be easy. It's meant to be impactful. It's meant to have a huge, a great effect on our life. And I know a lot of times we might be discouraged throughout that process because we might feel like we're not changing enough or fast enough. But I think one of the things I said to my client when one of my clients, who was a male, when he voiced that he wasn't happy with he voiced that he wasn't happy with the progress he was making, or he felt like he kept relapsing into old habits. I kind of just compared the process of healing in therapy to healing an old wound or a scab, a lot of times that scab, it doesn't really look pretty, and it's meant to protect the wound while it's healing. And a lot of times what we might do unconsciously is just kind of pick at that scab, and that might be us kind of getting in our own way of the change and the healing we may need. But eventually when we do allow it to just kind of do its own thing, we just see a scar and it kind of reminds us of what we've been through, but we realize that we're in a better place than where we started.
Thank you. Marlene?
So I think you both said a lot, so that was really great already. So with therapy, and it kind of piggybacks to the last question someone asked about the form of self-care. Absolutely, I look at therapy as a form of self-care. Also too, I think it's important for people to learn how to say no more, set boundaries, being able to rest, being able to ask for help. I know as Black women, and even men too, there's a superwoman cape that we got on, a Superman cape we got on. It's okay to ask for help. It's okay to take care of yourself as much as possible, because when you can say no to people, you give yourself the best yes possible. So that's the tip that I want to share. And I want to just a quick plug in, make sure you guys go get my book, The State of Black Girls. If you have a Black girl in your life that you're working with, it's great for clinicians, educators, for girls to read. Every chapter starts off with Dear Black Girl. But yeah, if someone can't go to therapy, there's always books. So there's always books that you can read and just learn more, and workbooks to kind of like get some coping skills. The book is on Amazon, and it's also on my website, marlenefrancois.com, but you go on Amazon because I know people have Prime, it's quicker for people. But yeah, so look for books, because those are great resources too to have to help you even with grief. So grief workbooks to help you through the process as you're looking for a therapist, so you don't feel like you don't have anything. So take care of yourself. That's the best advice I can give people, is take care of you.
Yes, thank you so much. And we encourage you to go out and get Marlene's book.
Yeah.
I mean, this is a phenomenal. I'm sorry?
That's all I added in the chat.
Oh, okay, wonderful, yes. So go out and get Marlene's book. One of the things that I want to close with is just to say that I'm thrilled to see so many people on this Zoom today. And it just speaks volumes to us as clinicians to see that there's still work for us to do in our communities, and we need to collaborate. We need to understand that, you know, going to church is a wonderful thing, but we need to also collaborate with faith-based organizations. We need to collaborate with the schools. I particularly love what someone wrote in the chat when they said therapy should begin in high school, you know, and that's an initiative that we need to really, you know, hone in on. So whoever wrote that, thank you for bringing that to the forefront. And again, we learn from each other. Therapy is a collaborative space where not only are you learning from your clinician, but your clinician is also learning from you. So we want you to come to therapy. When you're feeling like something isn't right with me, don't try to figure it out by yourself. Get a therapist, okay? Therapy does not have to be long-term. It could be short-term. It all depends on what you come to therapy with, what your goals are, what you would like to achieve. So one of the things that we really want to just encourage is you guys to seek the therapist. There's a lot of information in the chat in regards to where you could find a therapist of color. So we just want to encourage that. And if you're not satisfied with the current therapist that you have, feel free to find somebody else. Feel free to find somebody else. Like I always try to tell people, this is an abundant life. You know, you will get whatever you need. There's no competition amongst therapists. We share information. We want you to, and what we do sometimes, if I can't help you, I will say, Marlene, I got this client. Can you help them? And this is how we work, because we understand the need. We understand, you know, just our people, our culture, and the history that we've dealt with over these years. So we have a lot of generational stuff that we have to unpack in addition to what's happening now currently. So with that said, I just want to say thank you so much to our panelists, Ariella, Kevin, and Marlene. We are so appreciative of your time and your expertise. I want to thank the audience for being here. This warms my heart because it just really solidifies the work that we do. And it really makes, attending school and getting these degrees worthwhile. So I thank you all. And mostly I would like to thank Zeta Phi Beta Sorority Incorporated, Sigma Kappa Zeta Chapter, and our president, Camille Titus, as well as our community service members and group for just, hosting this entire workshop. We bring in information to the community. And again, this is just information, and I thank you all and have a good night.